అంటే సార్ మీ ఎక్స్పీరియన్స్‌లోకి వెళ్ళి 1 or 2 కేసెస్ డిస్కస్ చేయండి. అంటే విత్ యువర్ ఎక్స్‌పర్టైజ్ కావచ్చు, అంటే చాలా క్రిటికల్ హాస్పిటల్‌లో చేయడం కావచ్చు, ఇట్లా మీకు సంతృప్తినిచ్చినయి గానీ, లేదా పేషెంట్లు అయిపోయిన తర్వాత
నేను ఒక 2 కేసెస్ చెప్తా. ఒక పేషెంట్ యాక్చువల్‌గా ఐ షుడ్ నాట్ సే అబౌట్ ఇన్‌స్టిట్యూట్, వన్ ఆఫ్ ది బెస్ట్ టీచింగ్ ఇన్‌స్టిట్యూట్ ఇన్ హైదరాబాద్, టెర్షియరీ కేర్. 1 year బ్యాక్ he went there, he got evaluated, మొత్తము డయాగ్నోస్ అయింది. దే సెడ్ ఓన్లీ కన్జర్వేటివ్ మెడికల్. దట్ guy hardly 26-year-old. He was 20-year-old. Then he is on medical management, bedridden. Then 1 year later, rheumatologist looking after, cardiologist looking after, and he is under regular follow-up.
62 లక్షల మంది ప్రజల్లో మెడ్ప్లస్ బ్రాండ్ మెడిసిన్స్ కి మారడం వలన 915 కోట్ల రూపాయలు సేవ్ చేసుకున్నారు. అదే మెడిసిన్స్, అదే క్వాలిటీతో 50 to 80% డిస్కౌంట్లు.
1 year later, he came here. Then suddenly collapsed here. Difficult in breathing, florid pulmonary. Immediately shifted to medical ICU. Then they intubated. Then immediately they called the CT surgeon. CT surgeon said, no, this is a very complex case, so we can't do anything. Then he got admitted some other cardiologist. Then he said nothing can be done. Then they called me, sir, young patient, hardly 21-22. Incidentally, all relatives were my patients.
Okay.
Then they called me. Then I will try. See, young patient, it's worth trying. We should not give up. That is my attitude. So then I tell you just shift the patient. I'll try to do, but it will be more costly procedure. It may go to 10 to 12 lakhs. I'm helpless. We have to use more wires. We have to. Then we approach the left hand, right hand, left leg, right leg. The entire aorta, nearly 1 foot long, total block. Then approach from above, below. Then we put the balloon, dilated. Believe me, he completed 1.5 years. While leaving, he was bedridden and ventilator. Now, by the time he left the hospital, I told him to do the treadmill. He did treadmill here. Treadmill then, and then follow-up treadmill was done 1 year back. He has done 10 minutes exercise, extremely good. Such type of cases we do. Another patient, just now I told him, one patient from Karnaru. He is just like a completely paralytic, bedridden. He is a construction worker. Maniki sutarlu untaru kada. So Maniki, his brother went to do the work. There only fell down, unable to get up. Then he took them to their Pratima hospital. Then he developed renal failure. They did 2 cycles of dialysis. Then after that he visited all. Then went to Chalmada. We shifted and we crossed the vessel. We did 2-3 stents. Entire vessel is opened. For that case, I won the second best case in the world in Paris.
Okay.
Paris, there is a World Congress, Europe is here. I won the second best case. Great. Out of 1600 cities, this got selected as second prize. I'm very proud. Even today is active and alive.
Great.
That's it. So we did so many midnight primary PCAs with a cardiac massage. We did one patient actually 6 months earlier to the bypass. He came to me. We did angiogram. All 3 valves calcified, severely calcified. Then I told them, no need of angioplasty, go for bypass. Then they took for bypass. They did bypass, shifted to CT post-operative. CT post-operative, recurrent VTBF, shocks is continuous. We gave nearly 50 electrical shocks. After shock, it's becoming normal. But again, recurrence. Then surgeon called me, sir, I'm helpless. I tried everything, nothing can be done. Then I told, okay, this guy, if you leave it, he will go. Then I will shift to angioplasty. We shifted, and the entire were calcified. We did rota, almost 2 hours. We struggled, we opened. After that, he became perfectly fine. So we do such type of complex PCA, cardiac arrest, emergencies. One patient, actually, carpenter here, local, what is that? Alval carpenter son. He's ex-carpenter son. He came to us, before that he had a viral pneumonia, chest pain, difficult in breathing, got admitted under physician. Then they called me, and he developed MI. All 2 well stented. Then we told them he is absolutely fine, shift to room. 2 days later in the room he got he suffered from cardiac arrest. Cardiac arrest, again, sir, stent, everything, why cardiac arrest? Again, we went there, revived, shifted to ICC. Then one day fine. Next day again episodes of cardiac arrest. We were reviving, recurring. And then after that with Xylocard, Amidrone drugs, is maintained well. Then he was kept in CTICU. Evening 9:30 started electrical stamp, we say. That means the heart rate will go to 250, 300. Heart will not function. Almost 1.5 hours we were massaging the patient with nearly 40-50 DC shocks, and immediately we put him on ECMO. ECMO is the circulatory support when the heart is not functioning. We put him on ECMO. Then we did overdrive pacing. Then with sympathetic nerve blockade. Then ECMO with IABP support we gave. He was here for 50 days, completely unconscious for 1 week. Then gradually started responding. 65 days later, he recovered, went home. So such type of case we did. But always put it. Sometimes, unfortunately, for some patients, they develop complication. We feel very bad. Rarely we think something it may go different. Those are all very rare instances.